That's why wilderness therapy in these tight-knit groups, these family-like groups, becomes a fantastic microcosm for the family. That's why after a couple of weeks, we can describe the same kind of interactions your child having with staff and peers that were occurring at home. Because it's the same person. Whether you move the scenery or not, it's still the same play. It's still the same act. It takes a little while for relationships to get intense again, but it's still the same act. Salvador Minuchin, I referred to him a moment ago. He's a family theorist, one of the pioneers out of Philadelphia. He described family problems as the inability to adapt to the phases of the family life cycle. That these different stages of life require different kinds and qualities of parenting. And it's true. I have, unfortunately or fortunately, I have children at very distant life stages. I have an 18-year-old in college, a 17-year-old in high school, a 9-year-old in elementary school, and a 3-year-old in preschool. So they're going, and so they require different kinds of skills and tools and insights and interactions, of course. And I always say this is one of the great challenges. If I could treat everybody like a 3-year-old, it'd be pretty easy. If I could treat everybody like an 8-year-old, it'd be pretty easy. But I have to adapt and be flexible. And Minuchin starts to talk about this idea of flexibility over time, and even, of course, he describes between people in the same phase because they're negotiating it differently. He talks about flexibility being a significant indicator of family or parenting health. What works at one phase can be counterproductive in another phase, of course. And I find that to be particularly a difficult adjustment, not just for the adolescent to young adulthood, but oftentimes the parents of adolescence to young adulthood. They get confused. And it's difficult because a lot of times their young adult children are dealing with very dangerous and risky behaviors and low functioning and unhealthy decisions. And I've had parents call me recently to consult on family issues, dealing with a mid-20s child and taking on the responsibility, the burden of these problems the same as if it was their 12-year-old. You know, putting the same kind of energy in. How do I help my son get a job? How do I help? And I've had to say at times, that's not your problem anymore. Well, what if he does X, Y, and Z? Then that will be his problem. And again, it's not black and white, and I'm not an expert on what everybody should do with everybody, but I can begin to talk about this idea of it's different. It's qualitatively different as we move along, and sometimes we struggle with adjusting to that. I know I have, for sure, and I've seen that in families that I've worked with. What works for one child may be counterproductive for another child. The idea of differentiation and identity. I described family differentiation. Murray Bowen described he described this continuum of 0 to 100. He said nobody really gets to 100. It's some kind of ideal that we can conceptualize. But he describes the culture of a family at various grades along the scale. 100 being the most differentiated. Which, by the way, I want to make this as clear as I can. Differentiation includes connection. I think when I say differentiation a lot, people get confused because they think I'm talking about separation. In fact, I had somebody ask a question months ago saying, Brad, when are you going to talk about this reconnection with our children? You keep talking about individuation and healthy detachment. And I subsequently did a webinar on that individuation is the foundation of healthy connection. And then if there's not adequate differentiation, there really is no connection. It's some kind of mutation. It's some kind of pseudo connection, right? And you've seen that in your life. You've seen it in movies. You've seen this over dependence or overreaction to somebody else that demonstrates some evidence of a lack of a sense of self.